And I want to welcome everyone once again to our new student orientation. And I'll pull open my slides here as we begin. Bear with me one second. I have way too much open, unfortunately. There we go. Welcome to our new student orientation, and this is showing in display mode. I do apologize. Let me correct that real quickly. There we go. All right. As we begin, I'm going to run through a little bit of an agenda here. This is the Department of Public Health and Healthcare Leadership's programs. That includes the Bachelor of Science in Health Sciences, Bachelor of Science in Public Health, and Bachelor of Science in Healthcare Administration, among other graduate programs. As we jump into tonight's presentation, we will do a little meet and greet with our faculty members that are online. We'll go through department programs in great detail and do an overview, including missions, visions, and then offer quite an overwhelming amount of information and time for you to ask any questions that you may have. So as a little bit of a meet and greet, let's just go through the faculty that are here this evening. I can jump in since I'm already talking here. My name is Dr. Castor. I serve as the program director for the undergraduate bachelor's degree in health sciences, as well as the undergraduate bachelor's degree in public health. I also teach in both of those programs, so this will not be the last time you get to see my face. Dr. Pierman, I see you next.
Hello, my name is Dr. Carrie Pierman, and I'm the program director for the Bachelor's of Science in Healthcare Administration. And I also am working with the master's program as well. So when you finish up with your bachelor's, we'll get you right on over to the master's. But glad to have you here.
Excellent. And last but not least, Dr. Johnson.
Hello, everyone. My name is Dr. Sally Beth Johnson, and I serve as the chair of our Department of Public Health and Healthcare Leadership. I'm also an associate professor in our Health Sciences and Public Health program. So for those of you in the BS Health Sciences and BS Public Health, I teach global health issues, public health ethics, policy, and law, and also have the good fortune of working with those of you who are interested in research with Capstone. So welcome.
And Dr. Johnson, would you like to go over some of our programs this evening?
Sure. So as I mentioned, I chair the Department of Public Health and Healthcare Leadership, and that's where each of the programs that you are in, that is your home. So we have 6 academic programs in our department. We have the Bachelor's in Healthcare Administration, our Bachelor's of Science in Health Sciences, our Bachelor's in Public Health. And as you can see on the slide here, we have different tracks. We also offer minors. So for example, for healthcare administration, we offer an online healthcare organizational management minor. And then also for the public health, we have a public health minor. And we'll talk more about what classes are in those minors later in the presentation. But in addition to our undergraduate, we have pathways all the way through from a master's to even a terminal degree in terms of a doctorate. So we have our Master's of Healthcare Administration. We also have a Master's of Science in Health Sciences. And with those, we have tracks, concentrations, and we even have a new certificate program. So for those of you in MHA, we can do a direct, or for those of you in the bachelor's program in healthcare administration, we can do a direct admit into our master's program. Also within the Master's of Science in Health Sciences, we have a concentration in clinical research administration. Or if you're not ready for the whole master's degree, you can do a 1-year certificate program, which is called a graduate certificate in clinical research. And then the doctorate of health sciences, it has tracks in healthcare administration, community and public health, also higher education. And we're just kicking off this year our graduate certificate in health professions education. So we have a whole portfolio of programs related to being and becoming healthcare leaders, also working in terms of our communities and training that next generation of health professionals. Uniquely to our department, our programs and majors are available 100% online, and our bachelors are classified as hybrid, meaning some of those classes might be taken in person and some online. So that's an overview of our program. And
Excellent.
the next slide, I think we were going to talk maybe about some of the faculty that teach in each of these disciplines. So I mentioned that myself as chair, and then for healthcare administration, we have 3 full-time faculty, Dr. Pierman, who is here with us, also Dr. Becky McIntyre, and Dr. Jacob Elias. For health sciences and public health, we have 5 full-time faculty that teach across our bachelor's and our master's programs. And in addition to our full-time faculty, we also have a full team of what we call adjunct faculty. And our adjunct faculty help bring the real world into each of our classes. So you see a full list of names here with lots of different credentials, both clinical and non-clinical credentials. So these are individuals who are working in health administration, they're working as leaders in public health, and they're helping to bring their experience into the classroom. And so when we look at our 3 programs, just like to share our mission statement for each of them, and you'll see that there's some common features. So for our bachelor's in healthcare administration, this degree, the mission is to provide you with a broad base of knowledge and skills, really that you will be prepared for the general analytical, communication, and management competencies for all those professional jobs that are in the field of healthcare administration. For the Bachelor's of Science in Health Sciences program, our aim is to help prepare you to apply scientific reasoning, to communicate effectively, and also to enter health-related professions that aim to improve health not only at that individual level, but also at the community level. And then our Bachelor's in Public Health program, this is an interdisciplinary degree, and it ultimately is preparing students to improve health and through wellness, health and wellness, community health and wellness through both education, advocacy, and service.
Outstanding. Thank you for that overview, Dr. Johnson. At this time, I would like to turn it over to Dr. Pierman to talk about the degree, the bachelor's degree in healthcare administration.
Okay, wonderful. We do have a traditional track and also a 4+1. We'll talk about the traditional, and they kind of blend together a little. So, but we'll primarily talk about the traditional track. We are transfer friendly, so we do accept quite a few credits if you've been to another institution. So please get those submitted so those can be reviewed. Primarily, our course of study is your last 2 years of study. And in that, you'll be able to determine a track that you have maybe particular interest in. We do have the medical practice management, which is the 489 and 490 courses. 489 is an actual course, and then 490 is the internship, and it's 120 hours. And it's usually completed at a physician's practice. The healthcare administration is set up very similar to the medical practice management in that it also has a class that's the 449, and then the internship is the 450 course. It also is a 120-hour internship, and it is a hospital-based rotation. Some students have preferences maybe for human resources or quality or maybe IT or human resources finance. So those are opportunities that our students have as well. We also have the long-term care track. If you're interested in becoming a long-term care administrator, we do offer the 492 and 493 course. They each have a total of 200 hours each semester in those courses for a total of 400 to complete the internship. it's a little bit more intense and it takes a little bit more planning, but still a very much a worthwhile profession. And lastly, we do offer the professional seminar, and this is designed for students who already have healthcare experience and maybe work full time and can't have work release to be able to do a different internship. So you would take the HADM 489 course and the HADM 449 course. We are 100% online for the last 2 years of study, and we are structured and are fully aware that 99% of our students work full time while they attend our classes. Many of our students are seeking opportunities either where they currently work to move up the career ladder or they're looking for career paths and career advancements in healthcare. We are members of the Association of University Programs of Healthcare Administration, which you'll see the little logo there, the AUPHA. That's the standard for academic programs for healthcare administration. And we also have an honor society that's part of that, the Upsilon Phi Delta chapter. And we do honor our students that meet the criteria for that as they get close to graduation so that we can induct them into the honor society. Graduates end up in many places. So really anything that's healthcare related, it can be in the community, it can be in the hospital, in a physician's practice, or any type of public service type areas, even pharmaceuticals sometimes, and even banking sometimes want healthcare administrators. So lots of opportunities. This is our minor. It's the healthcare organizational minor. All of the courses are online, and you do need a total of 15 credits. You would take the first 3 classes, which would give you the 9, and then you can pick 2 additional classes from the list at the bottom.
Excellent. Thank you, Dr. Pierman.
Certainly.
And next up is our Bachelor's of Science in Health Sciences degree. This is going to be one of our most transfer-friendly degrees at the university. It is a very foundational degree that is tailorable or flexible to get students to go to wherever they want to onto a master's program. It is designed to be a hybrid program, but is completable 100% online. So really ideal for the working professional or individuals that have a busy lifestyle. It prepares students for entry into the professional healthcare related field, as well as graduate programs. Again, many of our students, like Dr. Pierman's, will use this for career advancement opportunities or to springboard into some sort of graduate coursework. In the field of health sciences, our students will complete a senior level culminating experience. And here we have 3 different options that students can choose from. The first is a formal internship. The internship is split over 2 academic semesters, where a student identifies an internship agency that they're interested in working for, ideally something that they would like to have a career in after they graduate. Students then complete 120 hours per semester while they're enrolled in the internship course. So this includes internship 1 and an additional 120 hours in internship 2, totaling 240 internship hours. Ideally, at the end of an internship, the organization that you're an intern for offers that student a career or a position at their agency. Next option is going to be service learning and civic engagement. Again, this is going to be a series, part 1, followed by part 2. With this series, students identify an agency in their community that they're passionate about and that they want to dedicate their time to and learn from that organization. There's 40-hour service learning requirement per section, totaling 80 total hours of service learning. The final option we have is a formal capstone project or research-oriented project. Again, it's going to be a series, so capstone 1, followed by capstone 2, where students work with a core faculty member, usually in a small group, and they conduct research in some element, preparing them for a research-oriented master's and/or doctoral level program. In the different Tracks we offer in the field of health sciences are the traditional track, designed to be the most flexible. This is great for brand new students who may not have any college experience, or for transfer students who have 60 credit hours, maybe of community college experience or another institution. You can transfer those 60 credits in and then finish the Bachelor's of Science in Health Sciences in 2 academic years or 4 semesters. The next option or track that we offer is a 3+1. So students who may have 87 or more earned credit hours from another institution can transfer those in and then complete their bachelor's degree in 1 year or 2 academic semesters. Those semesters are 15 credit hours followed by 18 credit hours, totaling 33 credit hours. And the last option we have, or track we have, is the accelerated 4+1, bachelor's into a master's of health science track. In this track, students work on 9 credit hours of graduate level coursework during their senior year that transitions into the Master's of Science in Health Sciences program, which makes it an expedited master's program. All of these, again, are completable at 100% online or as hybrid programs where you're able to take classes in person and online. Very similar to the Bachelor's of Science in Health Science, we have the Bachelor's of Science in Public Health. Again, very flexible degree that is very transfer friendly. So students can transfer upwards of 60 credit hours or 2 academic years into the program. Notably, the Bachelor's of Science in Public Health is designed around community health and wellness. So individuals that are really interested in helping their local community develop, evolve, whether that is policy regulation or helping community efforts, may be really interested in this major and or the minor. There is an emphasis on improving health of the medically underserved in our rural area here. It is very interprofessional. So you will have collaboration with PTs, OTs, PAs. You'll learn from a lot of the other disciplines in the field of public health as you'll be working with them as a public health practitioner. Again, we offer or require a senior level culminating experience in the field of public health. Notably here, we offer 2 options that students could choose from. The first is going to be 2 semesters of formal internship. Again, 120 hours of that internship experience per semester, totaling 240 hours. And that capstone 1 followed by capstone 2 research series. This is a professional degree where students are eligible to sit for their Certified Health Education Specialist National Board exam following the conclusion of their bachelor's degree. Very transfer friendly, also can be completed 100% online or in a hybrid format, taking classes in person or some online courses. Now, for students that may be not in the public health major, so Dr. Pierman's program or the field of health sciences may be interested in picking up a minor in the field of public health. The minor in public health consists of 15 credit hours, all completable 100% online. Students are required to take the first 4 classes listed above here, and then are able to tailor their experience by picking the 300 or 400 level elective that best suits their desires or needs. In terms of all of our undergraduate academic programs, we do have some policies and a standardized grading scale. Students all complete a minimum of 120 credits, regardless of the program that they choose. And we do require, university requires, students complete their degree program with a minimum GPA of a 2.0 or higher. In terms of your program-specific courses, we require that students complete all of their programming or their program-specific courses with a letter grade of C, specifically 73% or higher, in order to continue on in their respected program. Transfer students or students that are coming to us from another institution or the community college know that you must complete a minimum of 25% of your overall degree plan of study with Radford University in order to earn your bachelor's degree. Notably, students will be assigned 2 academic advisors throughout their time with Radford University, depending on the number of credit hours they begin with. We have general academic advisors from the university that work with students in their first 60 credit hours or freshman, sophomore years at the university. And then we also have program-specific advisors like myself and Dr. Pearman, among some of our other faculty members, that will work with students one-on-one as they get into their specific programming. A little expectations of students here, as you can see on the slide, we do have very high expectations and prepare our students for entry into the professional workforce across the board. So we do expect our students to be prepared and participate in classes, whether that is in person or in an online format. Our classes are designed around synchronous formats where students meet with the professor and the entire class at least 3 times a semester. That is either via Zoom, or obviously if you're in person, you're meeting with the professor on a weekly basis. We do require students to submit your work on time through whether that be weekly modules, quizzes, exam, homework, etc. There is a deadline there. We also encourage and require students to meet with one of their academic advisors at least 1 time a semester to make sure that you're still making adequate progress towards your degree plan of study. And if there's any changes that you should want to make to your degree plan of study, that academic advisor can help you make those changes. College services, as we heard from our guests at the beginning of this presentation, here are a few of them that are listed: academic coaching, tutoring, counseling, library, writing services, etc. Remember that those services are absolutely free to you as a student, and we strongly encourage you to utilize and take advantage of those services. Again, communication, as we saw from our kind of our mission and vision statements, are sprinkled throughout each of the 3 undergraduate programs. Our programs are designed to instill professional communication skills in all of our students, and also an element of community service. All of your professors are engaging in community service. We encourage you and ask you to engage right along with us in those community events. In terms of that professional element, communication is just going to be one of those skills that you're going to learn throughout your undergraduate degree. As a public health and healthcare leadership student, you do represent not only yourself, but you also represent the program that you're in and Radford University, especially as you transition out into the local community through your senior level culminating experience and other interactions with your local community. So we do have a professionalism standard and expect all students to act professionally, representing themselves, their program, and the university at all given times. In terms of emailing, this is an area where we teach students to prepare in terms of themselves professionally as well as ethically. So when you're emailing, everything should be in a formal greeting. All of your academic professors, regardless of the stage of where you're at, undergraduate, master's, or doctoral level training, will have a doctoral level degree. So it is appropriate to either call them by professor or Dr. so-and-so in an email. As you address them appropriately. And be sure to title your email and sign your email with your formal name or your preferred name that you would like to be addressed back by. Remember in your emails to always be professional. This means not swearing in your emails, avoiding slang terms, avoiding jargon, not using text talk as well. And Dr. Johnson, I'm going to turn it over to you at this time for some professional overviews.
Yeah, so as we're talking about professionalism, one thing that all of your faculty are involved in terms of staying current in their field and giving back to their profession, are a whole host of different professional associations. Some of these professional associations are local, regional, or at the state level, and others are at the national level. And so this slide that shows a variety of different logos just highlight just a few. There's many out there, but our faculty are involved with, for example, the American Public Health Association, also the state chapter, which is the Virginia Public Health Association, the American College of Healthcare Executives, the Central Virginia chapter of healthcare executives, the Healthcare Executive Group, SOPHE, that is the Society of Public Health Education. Based here in Southwest Virginia, a lot of our work does work with underserved rural communities. And so we are very active with the Virginia Rural Health Association. And then we also have topical interests. For example, my background, I started as a health education specialist, really working on one of the #1 preventable causes of death and disability in our country, which is tobacco use. And we've made great strides with tobacco, but there's a lot of new emerging products, everything from electronic cigarettes and vapes. And so we have an active group that still works on creating a tobacco-free generation, and that's the Tobacco-Free Alliance of Virginia. We also have faculty who are interested in helping to look at the safe promotion of immunizations and vaccinations. And so there's a group called Immunize VA. I encourage you're going to be learning about these professional associations in your classes. Many of them also have student memberships and free student activities. So as you learn about them in your classes, please take advantage of that. We attend many of their state conferences. At times, as budget allows, we have scholarships for students to participate. Speaking of participation, another part of our mission for our department is that service to our community. And this is just a list of a few of our ongoing projects that you can become involved in and volunteer. Hands-on Healthcare is a program. It's led by Dr. Diana Williman Buckaloo, who you'll meet in the Health Sciences and Public Health program, but it looks at health outreach and education for English language learners. We also have a project, one of the Surgeon General of the US recently released a report on loneliness as a public health epidemic. Although we have social media and we're more connected virtually than ever before, we're seeing in terms of, many people aren't as connected to each other and to their communities. And so we have a project that helps with that called Project Connect. We also have an expert, Dr. Jenny Hall, who's part of our faculty, and she is an expert in tick-borne illnesses and has a program called Ticks in Virginia. There's a website, ticksinvirginia.org, but we do a lot of outreach in terms of how you can prevent tick-borne diseases. Here in Virginia, we are seeing some of the highest rates of alpha-gal syndrome, also Lyme disease that we've seen in recent years. I serve as a volunteer clinical director for the Special Olympics Healthy Athletes program, both here in Virginia, and then I'm also involved with the Special Olympics USA and their Health Messenger program. And so there's opportunities throughout the year to help do screenings with individuals with intellectual disabilities at their regional, state, and national games. Looking in terms of not only individuals that are athletic and maybe at the school age, we also do a lot with aging services. And so our local Office on Aging has a Center for Health and Wellness that's always looking for more support to help with their programming. One of their evidence-based programs that we have faculty trained in and some students have done some projects to help them is called the Matter of Balance Fall Prevention Program. And so please keep an eye out. We will be sharing these in your D2L and do encourage you to participate. These are great for one, finding out about your community, but they're also great for, testing out. Do I like working with younger people? Do I maybe like working with an older population? And of course, you can put this information on your resume to show like, yeah, I have experience in my field.
Excellent. Thank you, Dr. Johnson.
Mhm.
And as previously alluded to, we strongly encourage student engagement and community service, regardless of the community that you're currently living in. All right, next is some general program information that has been a little confusing in the past. So I just want to clarify the terms that we use here at the university. When you hear the term Radford University, this is referring to the institution as a whole. Think of it maybe as an overarching umbrella. This is where your degree will be awarded from. On your actual diploma, it will say Radford University, regardless of which campus site you are at, main campus or here in Roanoke. Now, under the university, there are multiple different colleges. Our programs and our department fall under Waldron College of Health and Human Services. Under each of these colleges, you then have multiple departments. We are the Department of Public Health and Healthcare Leadership. And then finally, under your department, you have your academic programs. Again, we have 6 academic programs. There are 3 undergraduate listed here for your review. So the bachelor's in healthcare administration, or bachelor's of science in healthcare administration, the bachelor's of science in public health, and the bachelor's of science in health sciences. Now, we do have program handbooks or student handbooks for each of the corresponding programs. These are updated every single year and will be coming out relatively soon for your review. So be on the lookout for this. We do require students to read these, electronically sign and return their receipt. They have read their student handbook, regardless of the program that they are joining us in. And then finally, in terms of career pathways, regardless of which of our 3 academic programs you are joining, there are multiple different careers that you could enter after you graduate. There are 2 wonderful resources, and actually images listed on the bottom of this slide. They're going to be textbooks, essentially 101 careers in public health, as well as 101 careers in healthcare management. I strongly encourage students to pick up a copy of this on Amazon, or even a used copy on Amazon. These can kind of direct how you may want to tailor your undergraduate education for a specific career as you move forward. We do also offer talent from the career and talent development, a career coach that can assist you in writing up a resume, going through mock job interviews, reviewing that first job offer. Laura Crane is our career coach that we heard from the Center for Career and Talent Development earlier. You will experience work with Laura Crane and her colleagues in many of your classes as you progress through your undergraduate education. But you're more than welcome to reach out to her at any point in time and establish any communications or needs that you may have, whether that is a resume, a cover letter, anything along those lines. She will be your point of contact. And then finally, we do have a very robust online presence. No matter what platform you are on, we are also there. So please feel free to look us up. Again, the Department of Public Health and Healthcare Leadership, whether that is on Facebook, X, Instagram, etc. And then finally, we always love to hear from our students, whether that is from you actively as a student or even after you graduate. We love to hear student testimonials. And these are a couple live links that you can click on to hear from recent students who have graduated and have gone on to grander things, whether that is a career, graduate school, etc. Please feel free to stay in touch. We love hearing from our students after you graduate. Dr. Johnson, would you like to talk about a couple of our upcoming events as well?
Sure. So we have a tradition here at Radford. It's called the Roanoke Star Trek. And our Department of Public Health and Healthcare Leadership, we partner with Student Affairs here in Roanoke. We support the hike to the top of Mill Mountain to see the Roanoke Star. We offer a water stop halfway, but this happens the Saturday before classes begin. So that is this Saturday. And so 10 o'clock. So for those of you who are in the Roanoke area, or if you want to make the trek to Roanoke, right outside our campus, there's a large lawn. It's called Reed Lawn, but we will be gathering there at 10 a.m. Now, this hike, it's suitable for beginners. It includes sidewalks and some trails. There's some delicious, there's a local tropical ice stand that will be waiting for us at the top of the star. If you're not quite up to getting the physical activity, but do want to see the beautiful view overlooking the Roanoke Valley and come and interact with other students and faculty, there will be a van leaving Reed Lawn, which is the entrance to Radford University at Carilion at 11 o'clock, and then you can ride up to the mountain. But this is a fun tradition. Dr. Castor and myself will be out there at the water aid station. We'll also be having that tropical ice, but hope you can join. We learned earlier this evening from Student Affairs about all the different activities that are happening. They're available for both in-person and online students. They have a club fair that will be on Tuesday, September 2nd. It's here at the Highlander House in Roanoke. But also the Are You Involved? We'll share everything from that club fair in terms of all the different clubs that you can join. I'm very proud of our department in terms of our Epsilon Phi Delta Honor Society, which is recognized as a student organization, a student club. It was the first at Radford to be developed exclusively for online students. So like meetings and activities, which is professional networking, like webinars, those will be available online, but still can come and meet and greet in person too. So that's coming up. I think we also had a couple more. Yes. So for those of you, again, in the Roanoke area, right across from Radford University at Carilion is Elmwood Park, the downtown park, and it is Radford University night. We originally had this scheduled for July, but it was storming. And so they postponed it, which I actually think is awesome because this becomes right when students are here for the semester. So the new date is Thursday, September 4th, and this is in the evening. You will see information in your emails from Student Affairs about this, but our faculty would be there. So if you would like to come out and interact with others, it is free for all Radford University, and you can bring any of your family and friends with you. One thing in healthcare, sometimes, even though we're promoting health, we sometimes do not practice what we preach. We get so overwhelmed with our work and our family and that paper due that we forget to take care of ourselves. And so really delighted to see that our student affairs here is practicing what we preach and organizing a lot of different well-being activities. They have a whole well-being series that you'll see, but one that they're doing is called Let's Walk. And so for those of you in Roanoke, even as online students, if you work here, come join us. We'll be meeting right in the Student Affairs office and taking a 30-minute walk to get some steps and some fresh air every Thursday throughout the semester. And if you haven't been to downtown Roanoke, it's a great kind of walking through the parks and seeing some of the shops in downtown area. Another event, again, you'll see a pattern here of really promoting active, healthy lifestyles within our department, is here in Roanoke. We are the Highlanders. And with that comes our tartan, the one thing that I love and can't wait for you to get there. But every graduation, we have our Highlander, our bagpipers, our pipe and drum corps. And so they will too be at the Tartan 5K. It's a twilight run on Friday, September 19th. It'll start at 6:10 at the River's Edge Park. This is something that our department, so if you're not up to walking and running, we would still love for you to come out because we will be manning the water aid station at the finish line. So we're looking for volunteers to help with that. But just wanted to put a plug for this, or just some of the activities that are happening in terms of our campus and our community here at the beginning of the semester. So mark your calendar, and we would love for you to come out, and so we can meet you and engage in some of our Rafford events.
Excellent. Thank you, Dr. Johnson. Thank you. And as always, if you have any questions that come up after our presentation tonight, you're always welcome to reach out to any one of us. All of our contact information is here on this slide. Again, Dr. Johnson serving as our department chair, Dr. Pierman serving as our undergraduate and graduate program director for healthcare administration, and then myself serving as the undergraduate program director for health sciences and public health. And in the event that you reach out to the wrong person, have no fear, we'll get you connected with the right person. All right, and I want to thank you all for your time this evening and open it up and see if there are any questions from our students.